Hi, I'm Dr. Beech. This video is designed to just teach you our basics about doing your home Marma therapy and some of the creams that we use and procedures that you do at home. So, how to apply the transdermal creams that we prescribe. First, if you're applying them to a Marma point, that's a point where I've told you to apply in circles. You use the fourth finger or ring finger of either hand. Touch should be much lighter than you think, almost like trying just to massage the tiny hairs of the skin. And you apply the cream in a small clockwise circle to each of the points. Now, the Marma setting, we should do that in a quiet area with no disturbance. Turn off the radio, computer, not only to minimize distractions, but also to reduce any EMF toxins that can pollute the Marma points. Now, there are several creams that we use. Transdermal creams are used because they can absorb right in through the skin. There are many of them. The creams that we use very often is called DGL, deglycerized licorice, and it's opening to the channels without heating them. The purpose of using DGL on the Marma points in the spine daily is to enhance the reception and flow of prana in the body. Now we put DGL on the Marma points on the hands and the feet. You want to start with the ones on the hands first, right on the palm of the hand. So if you come right off of the pads of the finger, and that little depression, that would be the point. And when you're doing it clockwise, think of it as if putting a watch on that point. If you put a watch on that point, the way the watch moves, that's clockwise. That may sound silly, but if you put it over here, it's got to be a different direction. So always think of that watch. On the feet, think of the feet like the hands. So you have the toes, but you always, just like in the hands, you have that padded area. And if you go right off of that straight down, there's that depression in the feet. That's the point on the feet for the Marma point. So you want to do the hands, the feet first with your DGL, and then finally the top of the head. And the way you find the point on the top of the head is if you take the heel of your hand and just put it right on the bridge of the nose like that, where your middle finger touches. That's the top point that's called Adipati Marma. So this point on the top of the head is for the reception of prana into the body, and these other two areas on the hands and the feet are for the release of used prana. And as I said, clockwise circles, think of a clock or a watch on the area, and then you'll never make a mistake with your clockwise circles. So there are other creams that we use besides DGL, very common creams like Arjuna, Shoka, Brahmi, circulation support, Gaduchi, many creams that we apply to different areas on the body, but especially the spine. Almost all the transdermal creams can be applied generally to the whole spine. This application opens the main spinal channel that flows prana to all the different areas of the body. So we apply the transdermal cream to the spine in the morning and evening. If you don't have someone to help you, then you can apply it to just the neck and the low back. Apply it along the spine from the base of the skull all the way down to the sacrum. And then slowly swipe the spine from the head down to the sacrum 7 times so that it vibrationally opens that area. No mantra is necessary when you're putting the creams on the spine. Mantra is only for these small points where you're doing the circles. Now, we often put DGL cream on the liver. We apply DGL on the liver in the morning and the evening. Notice that the liver is mostly, it's on the right side of the body, and it's mostly beneath the rib cage, okay? So it extends over, but it's mostly on the right side. So we apply DGL in a clockwise circle, as if a watch were there, like that, over the liver, like that. No mantra is necessary for that application. Also, we use something called liver clay on the liver. So this is where we take liver clay. It looks like just kind of looks like dirt, actually, but it's not. It's clay. It's a medicated herbalized clay, and it's a powder. And you can just put some in your right hand a little bit, and just take a Actually, in the left hand, I think is better. Put it in the left hand, then put a few drops of water and just make a mud. And then you apply that to the liver on the right side like this in a clockwise direction. And then just wash the hands and leave that on for about 5 minutes, no longer than 5 minutes, because if you leave it on too long, it dries and squeezes toxins out of the liver through the skin. We don't want that. We want to just about 5 minutes. It'll be pasty, still a little wet and a little dry at the same time, and it's delivering lots of soma to the liver. Then you can take a shower and wash it off, or just wash it off with a washcloth like that. Creams on the lower abdomen that we often apply would be fennel cream, Procrete cream, and Superflow cream. All three of these creams are good for the lower abdomen. Fennel especially helps to reduce gas and improves the downward motion of the flow, what's called the gastric motility. Procrete nourishes the gut, nourishes the probiotics in the gut, and also is very, very powerful for improving the flow downward. Superflow is there if we need to connect the mind and the what we call the brain of the brain. The gut is called in Shakavansya Ayurveda the brain of the brain. And like if we have something like IBS or severe constipation, sometimes there's that connection between one brain and the other brain isn't good, and Superflow can help that. When you're applying the creams to those areas, you want to go clockwise like this, circles in the lower abdomen. So this is the upper abdomen, this is where the stomach is, liver's over here. This would be considered lower abdomen area, where the colon is. So the stomach, we apply some creams to the stomach. DGL is often used, especially if there's acidity. We would put it on the stomach in a clockwise direction like that. Notice that the stomach is between the rib cage mostly. Excuse me. More over to the left side, so in the middle and over to the left side of the body. So DGL can be used if there's a lot of acidic burning. Fennel is also used there. And then Pachaka support. Pachaka support supports the fire, the digestive fire of the stomach. So all those can be applied to that area. Just a little bit more information about the fennel cream. Fennel cream is also good for burning sensation caused by gastric reflux. When applying the cream, when I'm using this liver picture because it shows the sternum and the area of the stomach really well. But when we're applying the cream, you begin at the base of the throat, here, and swipe downwards all the way to the stomach there. So you apply the cream all the way down and then swipe downwards 7 times. And then you'll feel that cooling, alkalizing effect of this cream. And I've had many, many patients get relief from the burning sensation that's caused with gastric reflux by using this cream. Now, gastric reflux is caused by many things, and we have to have a complete protocol to actually correct it. But this can help alleviate some of the symptoms of that burning sensation, because fennel is very cooling, alkalizing, and it has an effect called anulomana, which means that it has a downward, this is a prabhava of fennel, it flows the energy downward. That's why it's so useful in the gut, because that's where the energy has to move downward. But I found that it's also good for this application as well. So do your Marma therapy daily. It's a hallmark of Shankavansya Ayurveda. The results with Marma therapy have been sometimes miraculous. They've always been positive and relaxing. And in other presentations, we'll go over even more specific protocols for Marma therapy. If you need more information, just contact us at this phone number or at our email address. Thank you.